Hi, everyone. Sorry it took me a little longer to get this out there, and I'm hoping my dogs don't start to bark in the middle of this. So let me go ahead and share my screen. Okay. Okay. So obviously this week you know already because you've been doing the work. It's on perfusion is our main concept with clotting. And remember that this is mostly obviously well, you don't know because I haven't done it yet, but this is gonna be from Giddens mostly. But remember, you gotta go through your Cooper and Gosnell and do those ATI assignments. That's gonna give you a fuller picture and it's gonna help you answer these objectives, okay? All right. So I thought I would start out by trying to connect this to a real life situation. I think we all could probably think about people in our family that has different health issues going on. I picked for right now my mom, who at this point is 82 years old, and she does have congestive heart failure. She has high blood pressure, and she's suffered for a long time with arthritis, and that results in overuse of pain meds at times. She had a hip replacement last year, which was related to her arthritic hip joint. And during her recovery, she ended up developing a pulmonary emboli, which restricted the blood flow to her lungs, resulting in damage to part of the lung. She recovered, but still suffers from decreased oxygenation, which is related to decreased perfusion, which was caused by the pulmonary emboli. Her blood pressure, even to this day, continues. She struggles with getting the right medication to help her keep that under control. And she really hasn't done well with keeping with compliance with her physical therapy regimen. So that's just one story. Perfusion refers to the flow of blood through the arteries and capillaries, delivering nutrients and oxygen to cells and removing cellular waste. The scope of perfusion, scope and categories. So basically you can divide it up into two different categories. One is central perfusion, one is tissue or local perfusion. Central perfusion is the force of the blood movement generated by the heart, the cardiac output. It requires adequate cardiac function, blood pressure, and blood volume. So its cardiac output is equal to stroke volume times the heart rate. Tissue or local perfusion is the volume of blood that flows to the targeted tissues. And it requires that the blood vessels remain open, that they're patent, that you have adequate hydrostatic pressure through them to get the blood to move, and that the capillaries are permeable, that they can drop off the blood, the oxygen. So this is a concept map. And if you look at it, over here is nursing care. So first of all, in the middle, you have perfusion. And this, again, refers to the flow of blood through the arteries and capillaries, delivering nutrients and oxygen to cells and removing cellular waste. So up here, you have nursing care. Here, nursing care is directed toward what contributes to a normal, to the normal concept, and is related to all the factors that are involved in and with that concept. So the concept of perfusion. And then attributes over here. These are the characteristics that define the concept. So what must be present for this concept to exist? So for perfusion, you have to have blood pressure within normal limits. You have to have a pulse within normal limits. You have to have a map within normal limits. And then you have antecedents. These have to exist before, so these are events or incidents that must happen before the concept can happen, all right? And these are functioning, a functioning cardiopulmonary system, adequate fluid volume, right here, and free from clots and arteriosclerotic blocks. In consequences, where did I put that? Over here, this is, or outcomes is another way to think about it. These are untoward events or outcomes that occur due to a malfunction in the concept. So you can have positive outcomes, right? And that they occur to the proper functioning of this concept. So you have the outcomes are the person is oriented, they have appropriate organ function, and they're warm to the touch. So in your assessment, you would be able to know that they have the positive perfusion by these things that you're assessing. And then you can have negative, and the negative would be the ischemic pain, tissue necrosis, and decreased organ, well, let's start up here, fainting, confusion, loss of fine tactile sensation, compartment syndrome, decreased organ function, and death. That would be a negative outcome of poor perfusion. And then up here you have the interrelated concepts. So these concepts, what happens in them, and what happens with perfusion and these different concepts, they all interrelate to each other. So they can affect change in each other. So concepts which work together to ensure a normal process, and they're concepts which, if depleted or impaired, can cause the negative consequences to occur. The subconcept, where did I put that? I don't see where I put that now. Are critical components of the major concept. Oh, over here, I'm sorry. So over here, the subconcept, these are critical components of perfusion. So volume, vascular tone, and pump performance. Impairment of the central perfusion occurs in conditions that decrease cardiac output or cause shock. Cardiac output is decreased when there is inadequate perfusion to the myocardium. Inadequate impulse conduction through the heart or malfunction of the heart valve. Wait. Sorry, let me. Impaired central perfusion. The impairment of central perfusion occurs when the cardiac output is inadequate. Reduced cardiac output is a reduction in oxygenated blood reaching the body tissues. So it's a systemic effect. Impaired tissue perfusion is the impairment of tissue perfusion with the loss of a vessel patency or permeability in inadequate central perfusion. Results in this affect body tissues, or it can have a localized effect. Populations that are at greatest risk, I believe you're seeing this like every day, right? Impaired perfusion can potentially occur among everybody, but regardless of age or gender, race, or socioeconomic status. However, populations that are at greater risk are middle-aged and older adults, men, and African Americans. Sources of the data from the patient as well as from the physical assessment and laboratory findings are going to help you get a better picture of perfusion in your client. So subjective data would be lifestyle behaviors, including diet, exercise, smoking, and alcohol consumption. A diet high in fat and carbs along with minimal exercise contributes to high cholesterol and atherosclerosis in the vessels and obesity. Ask the client about any chronic diseases that they have, like diabetes mellitus, renal failure, or any history of hypertension. Problem-based history, like they might describe pain, shortness of breath, edema, or possibly having fainting spells. If these symptoms are reported, follow up with a more focused assessment. Like, for example, if they're saying they have pain, we'll ask them where it is, how long it's been, is there any alleviating factors, that whole figuring out what's going on. Ischemic pain can occur in the heart or femoral arteries. Chest pain can be due to an MI or possibly a pulmonary embolism. So ask about precipitating factors like exercise or emotional distress. Pain in the legs can be attributed to PAD or peripheral artery disease or deep vein thrombosis. Difficulty breathing or dyspnea is inadequate circulation of the blood, interferes with oxygen delivery to the tissues, which can make them cause shortness of breath. This symptom may be reported by patients with primary perfusion problems, such as heart failure, or by those with primary gas exchange problems, such as COPD or chronic obstructive pulmonary disease. Edema may be reported. They may say, yeah, at the end of the night, I take off my socks and my legs are puffy and I have indentations from my socks. This is an indication of excessive fluid in the interstitial spaces, which can be an indication of fluid overload. The excessive fluid may occur from renal disease also, when the blood cannot be filtered by the kidneys. Right-sided failure is another cause of peripheral edema that develops if the right ventricle is unable to eject the usual volume of blood. Dizziness during assessment, ask focused questions to learn when the dizziness occurs, what are aggravating or relieving factors. Examination of central perfusion, you can note changes in the vital signs such as hypotension or tachycardia. Assess for orthostatic hypotension, take the blood pressure in the 3 positions, lying down, sitting, and then standing. Auscultate the heart sounds. You're looking for that S1 and S2, which are normal, but also assessing if there's any abnormal heart sounds, or the S3 and S4. Look for murmurs, indicate whether or not the heart is a regular rhythm, because that could be an altered cardiac electrical function. And looking at across the lifespan, you can have infants that can present low in weight and failure to thrive, and it can be directly attributed back to perfusion because they have a weak suck and they're having difficulty breathing while they're feeding. So this leads to the child ending up coming to the doctor because they're not feeding and failure to thrive. Children may present with, they may come in and the parent might explain that they don't run outside and play. They're very tired, or someone might be observing them out on the playground where they're squatting, and that indicates that they're trying to make up for their impaired perfusion. Some murmurs can be characteristic of some congenital heart problems. At birth, or with our preemies, we see what's called a PDA, or patent ductus arteriosus, is a really kind of common congenital heart problem. And that can close itself off, and the infant does fairly well. Occasionally they do need to seal the PDA. The other problems can be the atrial septal defect and a ventricular septal defect. Tissue perfusion is assessed when by looking at the lower extremities. The nurse may notice that there's less hair on the legs and the skin is pale. On inspection with palpation, it may be cool. You may not feel a dorsalis pedal or posterior tibial pulses. And these would be people who have slow capillary fill time. So greater than 3 seconds. Okay, and some common diagnostics test, enzymes and markers. So lab tests would be your enzymes and markers. Enzymes released from the damaged cells and circulating in the blood can be measured to confirm impaired perfusion. Serum lipid is measured to detect high blood cholesterol. So you look at LDL, HDL, very low VLDL, triglycerides. These provide information about the risk factors and the possible presence of vessel disease. ECG would be done, a 12-lead ECG, to record electrical impulses through the heart, which again is part of adequate perfusion, making sure that the electrical impulses, the heart, the ECG is normal. Some of the tests that we do to assess what's going on with the client also would be a cardiac stress test. And you can do these 2 different ways. If the patient is able to walk and is fairly healthy, they can do this test by hooking them up to the monitors and having them do a treadmill. And if they are not healthy enough, which I've had both my parents have this done, they actually do this pharmacologically, and they use different drugs to stimulate a physiological effect of what the exercise would do to the heart. And that can tell them that's done in very controlled situation. Clinical management of or primary prevention of these patients are smoking and nicotine cessation, diet, exercise, and weight control. So eating a variety of fruits and vegetables, grains, legumes, fat-free, and low-fat products like fish, poultry, and lean meats. You want them to reduce their sodium intake, actually less than 1,500 grams a day. Reduce saturated and trans fat to less than 10% of their calories, and participate in physical activities. So adults older than 20 years of age, at least 150 minutes per week. So when you think about that, what is that? 30 minutes 5 days a week. A moderate intensity activity. With children 12 to 19, you should encourage 60 minutes of moderate intensity activity every day. They should refrain from smoking or have no exposure to environmental tobacco smoke, and maintain their blood pressure within normal limits. So now they say adults older than 20 years of age should have blood pressures of less than 120/80, and children 8 to 19 years of age should be in that range also. Maintain total cholesterol for adults 20 or older, less than 200 milligrams per DL, and for children, less than 70. Maintain a fasting blood glucose that's less than 100, and for children, less than 200. And achieve and maintain a desirable weight. This is all hard, really hard for kids and adults, right? During this time, during COVID. So these are challenges. Screenings. So at what age should blood pressure screening begin? So actually it begins in infancy. We take a blood pressure screening usually before the baby goes home. If not, they take it on that first visit for the kids to the pediatrician. And then it's recommended at every well child visit, at least annually. And among adults, recommends screening for high blood pressure in adults 18 and older. Let's see, every year I think is what I had. For patients who have hypertension, they recommend every 2 years when blood pressure is less than 120/80. And the same committee recommends screening every year when the systolic pressures are 120 to 139, or diastolics that are 80 to 90. This is all in your book, so you can get this all in there. So the USPSTF strongly recommends screening men ages 35 years or older for lipid disorders, and screening men ages 25 to 35 years if they are at increased for coronary artery disease. For women, they strongly recommend screening those ages 45 years and older for lipid disorders if they are at increased risk for coronary heart disease. What makes these interventions collaborative? Treatment strategies depend on underlying condition. The most common strategies include diet modification, smoking cessation, increased activity or conditioning, and pharmacotherapy. Pharmacotherapy represents really the most common collaborative intervention for individuals with these conditions of cardiovascular disease. So there is a list of drugs to look at in your book. I'm just going to kind of go through, I'm not going to give you specific drugs, they are in your book, but for example, vasodilators that increase the diameter of the blood vessel, and they work in different mechanisms in order to do that. Vasopressors that decrease the diameter of the blood vessel by stimulating the alpha adrenergic or dopamine receptor to affect the normal mechanism of vasoconstriction. So remember, the blood vessels walls have to be, the word I'm thinking of, compliant, so that perfusion can happen, can get all the way through the body. Diuretics reduce blood volume by preventing the reabsorption of sodium in the kidneys, which increase the urine output. And there's different diuretics, they work differently. spiralactone, Lasix, or hydrochlorothiazide. Those are all ones that come to mind. Antidysrhythmics are correct erratic electrical impulses to create regular cardiac rhythms. I would think like conditions like AFib or ventricular, any kind of ventricular dysrhythmia. Cardioglycosides have a positive inotropic effect with a lowering heart rate to increase cardiac output and are used for the treatment of heart failure. I want to say digoxin is a cardioglycoside. And anticoagulants are given to prevent blood clotting. In someone that has an atrial fib, they would give warfarin or Coumadin to help prevent blood clotting from the atrial fib. Antiplatelet agents prevent platelets from aggregating to form clots, preventing arterial thrombosis. And then there's thrombolytics that disrupt blood clots that may have already been forming. Lipid lowering agents decrease the level of lipids that contribute to the narrowing of the blood vessels or occlusion of the blood vessels. So take a look at those medications, and they're in your Giddens book, and they cover them in your Cooper and Gosnell. When would these are collaborative interventions, and when would they actually be used? So, sorry, just one second here. So antihypertensive, antiarrhythmics, inotropics, I actually did just go through all of these with you. I already went through those with you, so you can relook at those. Now, for clinical management, collaborative interventions, these are surgical or procedures that are done in order to help support perfusion. So you could have a pacemaker insertion. This is an electronic device used to increase the heart rate to in a severe bradycardic person by electrically stimulating the myocardium. Electrical cardioversion, basically this is when you shock someone. Now they can do that for different reasons. Obviously if someone's heart stopped, but they also can, maybe someone's in a run of VFib or in ventricular tachycardic, or any number of reasons why they may cardiovert somebody. Intra-aortic balloon pump, this provides temporary circulatory assistance to the patient in a critical care unit who has a compromised heart. Heart valve surgery, obviously they go in and they would repair a heart valve. Cardiac transplant, this is a transfer of a heart from one person after death to another person. Usually this person is in end-stage heart failure. Peripheral artery revascularization. This is done to basically support a brain, so they can, a vein. They can do a synthetic graft to bypass the lesion in the artery that's impairing the perfusion in that area. A stent placement or angioplasty. This is an expandable mesh-like structure designed to expand in the artery to maintain patency. An endarterectomy is a surgical procedure in which the artery is opened to remove any obstructing plaque. So a common one is a carotid endarterectomy. And actually my mom has had one of those done, and when her symptoms were increasing blood pressures, which she had, but also she was getting faint and would have periods where she would just feel really faint. And so the doctor went in and cleared that out. It was actually 90% occluded. So here you have nursing skills required for perfusion. Lucy, Jax, sorry, I think my dogs are gonna start barking. So assessment, the person needs to be assessed, cardiac monitoring, hemodynamic monitoring. These are all areas that need to be supported. I'm gonna have to pause this 1 second. Okay, sorry about that. They're probably gonna start barking again, but I have the case study from the book in here. This is George Jones, and he's 59 years, he's a 59-year-old male who has arrived at the emergency department with chest pain. He experienced this chest pain for 30 minutes, and it was not relieved after taking 4 nitroglycerin tablets, 5 minutes apart each he took. And he reports the pain feels, quote, like an elephant is sitting on his chest. This case exemplifies an impairment. Sorry, let me go back. He is diaphoretic and he appears anxious. His vital signs are as follows. Temperature 99, his blood pressure is 100/68, his heart rate is 110, and his respiratory rate is 24. Mr. Jones is overweight. He has type 2 diabetes. He has high cholesterol, and he's hypertensive. I'm going to pause this again. So he quit smoking last year after a 40-year history of smoking 1 pack of cigarettes a day. His troponin level is elevated, and the ECG shows the ST segment elevation. The nurse administers oxygen and draws blood for an arterial blood gas. Mr. Jones is told he will have a cardiac catheterization to locate the blockage, determine its severity, and evaluate left ventricular function. The cardiac catheterization revealed a 90% blockage in 1 coronary artery. The cardiologist performed a balloon angioplasty and placed a stent in Mr. Jones' blocked coronary artery and this reestablished the perfusion. Mr. Jones was admitted to cardiovascular surgery unit, and he's ambulating within 24 hours after the stent placement. The nurse's goals for Mr. Jones' plan of care are to maintain effective cardiac output, control his pain, relieve his anxiety, and balance physical activity with energy-conserving activities. The nurse also played a significant role in Mr. Jones' therapy by teaching him and his family about lifestyle changes, including diet and exercise and the purpose of his prescribed medications, including adverse effects of the importance of following the medication regimen. Mr. Jones is referred to a cardiac rehab after discharge. Most likely he would be sent home on obviously his blood pressure medicines, but also like Coumadin, warfarin. There's a couple of different ones he could be sent home on as far for blood thinning. This case exemplifies an impairment of local perfusion of the heart that could have developed into central impairment if Mr. Jones was not treated. He had several risk factors, including obesity, which contributed to type 2 diabetes mellitus. The hyperlipidemia and diabetes mellitus contributed to the blockage of his coronary artery and his hypertension, which increased the workload of his heart. Mr. Jones' manifestations were consistent with impaired tissue perfusion to the heart. The stent reestablished perfusion to the myocardium. Mr. Jones' recovery and prevention of further cardiovascular disease will be improved by his lifestyle changes. I'm going to play this for you. It's just a quick question.
Hey, Nurse Tim here. Today we're going to talk about perfusion. Now, perfusion is one of those concepts that you just have to be ready for at any time, any place when you're providing patient care. You never know when it's going to creep up. I remember working in Haiti, and especially after a huge natural disaster that we were working with there, an earthquake. We were going from house to house working with the U.S. Marines. We'd go into a patient's house. You never knew what kind of condition that individual would be in. And many times perfusion issues would sneak up on us, and all of a sudden we were in a critical situation trying to help this patient that was in dire straits. Let's look at an example here that is a very realistic one. Now, test questions. Remember, when you're caring for these patients on the exam, read the question twice. Read that stem twice. Apply your thin thinking. Pick your answer, take it back to the stem. Go ahead and pause the video when you're ready, answer your question, and then come back. Let's see how you did. All right.
So,
you guys ready? Here's the right answer. It is indeed call the physician and report the finding. And many of you are like, wait a minute, we're never supposed to call the doctor. There are some situations where you have a critical finding that requires immediate collaborative intervention. And this just happens to be one of them. As you're studying the rationale for this question, think very carefully about times when you compare left to right in that patient assessment. And in this day and age, when you have such little time to spend with your patients, you have to do that focused assessment quickly. And that's where we do compare left and right. Now, I get it. Some of you are like, I am just terrible at palpating pulses. Is it a +2? Is it a +4? That happens. That's why we compare left to right. When we find a variation in the left compared to the right, that's time when you need to maybe get others involved. Take that assessment finding right there, really focus on it. Why is there a difference when I palpate the left foot from the right foot? Okay, so as you study this rationale, keep that in mind. A lot of important concepts coming out here, especially how do I manage that patient with a critical perfusion need. Now, here's your study tip. You need to save time studying, okay? Let's just face it. When I work with students, doesn't matter what type of program you're in, no matter what your background is, a lot of wasted time when you're studying. A good way to manage a chapter, okay? You're reading this big, thick chapter, and you're like, what is important? How do I navigate this chapter? One of the best ways to do that is open up that chapter to the back of the book, back of the chapter, look at the case study for that chapter. Or maybe there's online case studies for that chapter. If there's no case studies for a chapter in a book, then go find a case study, a YouTube video, something that highlights a concept in that chapter, but focuses on a patient. Then what you do after you watch that video, after you read that case study, go back and make 3 highlights in the chapter based on that case study. That's going to help you really focus, do that priority assessment, that priority intervention that we talk about with Nurse Think that's so important. Save time studying. Focus on a patient. I'm Nurse Tim. Make it a great day.
I thought that was a good recommendation by him. So here are the interrelated concepts. You see this in the back of your chapter. So think about it. Because all of the cells in the body depend on perfusion to carry oxygen and nutrients to cells, the concept of perfusion is going to be interrelated to nearly all of the health and illness concepts within your book. The ones that are most closely interrelated with perfusion is patient complains of pain when the perfusion is impaired by clotting, whether it can be in the coronary arteries causing chest pain or in the iliac or femoral arteries causing leg pain when walking. Impaired tissue perfusion leading to ischemia creates lactic acid that contributes to pain. Because impaired tissue perfusion to the legs causes pain during walking, and peripheral arterial disease reduces the mobility of the patients due to the pain they are experiencing. Walking is beneficial to exercise the heart and improve central perfusion, and an important health promotion behavior. So nutrition is also important in health promotion consideration for health and vessel health. And adequate perfusion in the gastrointestinal system is necessary for digestion and metabolism of nutrients. So, and inflammation occurs when there is tissue damage, which is linked to ischemia. Also, it is the inflammation that develops after damage to the endothelium of the arteries that initiates atherosclerosis. Impaired perfusion results in impaired gas exchange because the blood carries oxygen from the alveoli to cells and carbon dioxide away from the cells to the alveoli from exhalation. Elimination from the kidneys is an indirect indicator of cardiac output, right? Urine output, if they're not putting out urine, why is that? Think about perfusion to the kidneys. Cognition is altered when perfusion to the brain is impaired. Patient education is central to the prevention of cardiovascular disease as well as management of cardiac disease. So you can see how these are all interrelated. Here are some exemplars. We actually, you know, they didn't have, I didn't see the DIC on here, disseminated interdisseminated coagulation. That is something for you see in pregnancy. Well, you don't want to see in pregnancy, but can be, which I was surprised because you don't just see it in pregnancy, you can see it in any time you have someone who's maybe been in a severe accident where all of their blood clotting factors are used up, and we'll talk about it. There actually is a case study that I have that I would like to talk about. So maybe tomorrow during our Thursday Zoom, we can look at that, unless you have just stuff you want to talk about for the test. These are some other exemplars here that you can look at. This was the tetralogy of Fallot for kids and infants. These are those kind of defects. And let's see. So, okay. And these are, the end of this is some questions that you can look at. All right, guys, I know that was fast. I was trying to do it so the dogs wouldn't interrupt this totally. So, all right, I hope your week is going well. This has been difficult, I realize that, but please reach out if you need something. And I think most people know to reach out through Google Hangout, email, you know, I'm available. But again, if you have questions because no question is a stupid question, if it's a question that you think more people need to hear, please put it in the Q&A on Canvas, the question and answer area on Canvas, or on the Google Hangout for the whole class. So then I'm not answering, because most likely it's a question that has already come up, and I'm not trying to rewrite it 15 times. Hopefully I would already post an announcement to stop that, but okay. I will hopefully talk to you guys tomorrow. Alrighty, talk to you later. Bye.